I'm Sergeant Carlo. I work at 22 Division, Toronto Police Service. So when we talk about data, we are specifically talking about data which is overdosing deaths. So across Canada, and this is from 2020, the data from 200 deaths per day across Canada. And then we come down to Ontario. Ontario, the data is per day deaths were around 126 in 2018. And per day, it was 4 deaths. Moving on, as of 2020, it almost doubled. It is basically 220 deaths per day, per month, and 7 deaths per day. And all this data is available in public forum. As far as talking about why it is happening, so there are a couple of things which happened in the last couple of years. There's a drug which is called fentanyl. It has been part of opioids. It's mixed in small doses. It is in the opioid family that has been introduced on the streets. So basically all these drug dealers are mixing it into everything. Why? Because the cost is low. It has got no smell. It's got no taste. It's highly addictive and cheap. So they mix it into different drugs. People think that they're consuming a certain kind of drug and they're addicted to one, not knowing that this particular drug is being mixed into everything. And this one is so potent, so intoxicant that it overdoses people without realizing. A small percentage of it could basically cause death to you. So that's why it's a opioid crisis. It is basically a crisis in which the overdose deaths have gone through the roof.
We have Sergeant Carlo from Toronto Police Services. So he has worked a lot on the issue of illicit substances on Canadian streets, Canadian markets. We will ask him the data. Officer, what data you want to share with us? How serious is the issue of fentanyl and illicit substances?
First of all, good morning to you, and very kind of you that you are covering this particular topic. It is important, and it is important for the community as Canadians. As far as you have asked me how bad is the crisis, if you look at different organizations have termed this as an epidemic. Mm-hmm. And I'll term it as two kinds of epidemics. One which started in Vancouver a couple of years back, mm-hmm. and slowly trickled down and reached Ontario too. Epidemic, it is epidemic because the numbers that we see as far as overdose deaths are concerned in the last couple of years is through the roof. So if we talk about all over Canada and we are talking about overdose deaths, it's approximately 200 deaths per day.
200 deaths per day.
And
it's a shocking data.
Yeah, and this is a data which comes from government organizations. Mm-hmm. And whatever data we are talking about, it is all available in the public domain, mm-hmm. on the internet. And you can go and check this data, 200 per day. Now, when we come down to Ontario, in 2018, if you look at, it was around 110, 115. And it has moved on, and I'm talking about a month. Ontario, yeah. 110 in 2018. But by the time we reached 2020, this data almost doubled, and it came to 226.
Okay.
If we talk about Ontario per day, 2018, it was 4 deaths per day. If you talk about today, it is 7 deaths per day.
7 deaths per day.
Per day.
In Ontario.
Yes, in Ontario.
But in Canada, it's 200 deaths per day.
Per day, yeah.
And what are the reasons of these deaths? What kind of illicit substances these people are taking and dying?
Well, if we talk about, I'll categorize into 2 phases, and I'll start from, it goes way back, okay. But I will start from 2015. So 2015 and 2020 is phase 3 mm-hmm. of this crisis. So starting from 15 to 20, it basically opioids, which is kind of, can be in normal language, we can say it is basically painkillers. Mm-hmm. So it's prescribed by doctors. It's only available in prescription. But even Tylenol has some quantity of opioids. So it started in 15 to 2000. It was basically fentanyl got introduced. It mm-hmm. came to Ontario, and it started getting mixed. Mm-hmm. Now the last phase, which we call the phase 4 of this crisis, that started in 2020, mm-hmm. and it is still today. Mm-hmm. What happened in between was COVID, mm-hmm. and mental health fell down, and that's where this crisis became even grave. Now, fentanyl, it's a cheap drug, no smell, easily you can mix it. It's got no taste. So on the street, it is being mixed into different other kind of drugs. Okay. And that's where people, think that they're consuming a particular drug that they bought off the street, but actually it is fentanyl. And fentanyl is the one which has basically got into this crisis situation that we are today.
We have seen that opium is also easily available on the retailers and on the streets. So does our law enforcement knows about this?
So when you're talking about opium, I think you're addressing the South Asian
yes,
community.
afim, which is called afim, which is
Yeah,
the opium. Raw opium is available on these retail shops
Yeah,
too.
so opium, again, it is under the CDSA. It is definitely a drug, okay? When I say it is a drug, I'm talking about criminal.
Yeah.
It is in that particular catalog of drugs, okay, where people get charged criminally. It is available. It is available like any other drugs on the street. It has got not that it is available and law enforcement is not looking into it. Definitely law enforcement look. If somebody is caught with that particular drug, they are charged with the same charges with any other.
But how come
stuff.
our retailers are selling this openly?
So when you're talking about the retailers, I am not aware of retailers.
Okay.
This is a general knowledge which is available to public, and I'm pretty sure it would be probably true what you're saying. If that is so, and I'm guessing you're talking about Peel region, not that I'm eliminating the other parts of GTA, but for sure, if that is what is happening, it should be brought to the notice of Peel police
It's
or
happening
whatever the
across-
police services.
Yes, it's happening across Canada by the retail shops and South Asian community, and they are the big consumers. We see the people in trucking industry, we see the people in construction industry.
Okay.
They are consuming it across Canada.
Okay.
So if I say like these labs, what kind of material is mixed with this opium? From where this is coming into Canada, or it is made locally here in Canada, or coming from?
So it's a very good question. 2023, in a forum, once I finished everything, a couple of people who walked up to me and asked the same question. And the question was, is what you say opium, afim, is opium safe? Is afim safe? And I said, well, your drug dealer, does he have a quality control office?
Yeah.
And the answer was no. I said, pretty much. He will mix anything which gives you a kick, anything which you get addicted to, and he will sell it. So if there is no certification given by him, which is from a trusted lab, fentanyl is getting mixed into opium too.
Yeah.
And you have the same risks of consuming opium or any other drug mixed with fentanyl, which other drugs have. So I think, even if you're talking about opium today would be mixed with fentanyl, there is no guarantee.
That's more harmful?
You will die.
Okay.
If you will die, it is just a matter of day. The day that you are waiting for your day, a bad day, and you will die. There's no question. You will get overdosed.
South Asian community, our youth, why they are consuming these drugs so heavily when they come from India? Is this culturally they are doing it, or?
So you can't really pin down a particular community for having more consumption or starting a consumption. But since you and me both belong to that particular culture, we know our background, that in our background, there are a couple of other things, which is intoxicants, especially alcohol, is very acceptable in our community. So if you look at our province where we came from, Punjab, in India, all these drugs are very much available there. So whatever is available there and people are used to, when they travel, that habit travels with them. And once that travels, it's basically demand which is traveling. And as far as drug trade is concerned, if you go into the background of drug trade for hundreds of years, wherever there is a demand, the supply automatically will find its way. And that's what is happening with us. The community grew. We came with these kind of addictions from back home because that was readily available there. And same is prevailing here. Supply has found its demand.
So can you share some cost data also with us?
When you're talking about cost data, so 2017, we as Canada were spending approximately $46 billion per year on everything concerned with addiction. And this is alcohol, tobacco, vaping, other opioid addictions, all of that. Now from 17, when we come to 20, this particular number became 49 billion. If we talk about today, this has not been published, but you can definitely find in public domain, it is around 51 billion. That's the amount of money that the government spends on everything related to addiction.
Okay. So, since you are in Toronto Police Services, how serious is this crisis in the city of Toronto of the addiction? How many calls you attend per day, and how serious is this? You see people dying by this addiction and these illicit substances on the
So,
street?
as far as numbers and data is concerned, we will stick to the data, which is the Canadian data.
Canadian data.
We are part of that.
Yeah.
It is a crisis. It has in the city of Toronto. It was declared a crisis, same as Vancouver. As far as overdosing is concerned, yes, we, the officers, every day respond to multiple overdoses call. So that is, I'm talking about just the division that I work in.
Yes.
So overall Toronto, definitely it's a high number. And if I have to give you a comparison, the comparison would be in the last couple of years. In the last couple of years, this particular calls, the overdose calls, definitely have gone up higher through the roof.
Okay, we understand that these fentanyl or other drugs are coming across the borders from other China or Mexico. But do we have labs here in Canada also? Because one lab was caught in BC.
Yeah, talking about the labs in BC, yes. That was the first time that probably we as Canadians discovered that yes, there is some kind of manufacturing which happened, which is again in public domain. And this is not the first time. This was, I think, the second time.
Second time.
The first time was a couple of months before that. So it is definitely being manufactured. How much? I won't be able to kind of quote on that. How
But
much?
was that the biggest lab in North America?
I guess it was definitely in Canada and probably maybe in North America too.
So being in law enforcement, you think that we should focus more the law enforcement and like we should have more resources to shut down these kind of operations in Canada?
Definitely, whenever law enforcement gets these kind of, investigations proceed, they are shut down. So I'm quite sure that the ones in BC, they are shut down. As far as law enforcement is concerned, for hundreds of years, law enforcement has been chasing this particular supply side of, drugs. What I feel is that probably if there is some work to be done, that is on the demand side. Demand side is in the public forum. In the community, there's a lot of work
Education,
done.
counseling, and all those things.
Yeah. So as far as law enforcement, thousands of millions of dollars which are spent chasing these guys. I think that if supposingly we start working on the demand side, and on the demand side we somehow curtail that down, that will choke the supply side, or it will reduce the supply side at least. Less of overdosing.
Okay. What message you want to give in the end to the public? Because we say one life lost is too many. But here the data, as you suggested, as the government side says, 200 deaths per day across Canada. Even in war, we don't lose our soldiers 200 per day. It's a very big crisis then as per us.
Yeah, it is. The message for the public is that get out into the community, talk about it. If you can contribute and change one life by information, or get in touch with people who have the information, organize seminars, forums, go to schools, educate your kids at home, make it public as much as possible, make the overdosing public, make fentanyl known to everybody, make the information as much as possible accessible to people that these are the consequences. Once we start working on that education part of it, I'm pretty sure there'll be an impact on the supply part of it.
Okay. Sergeant Kalu, thank you very much for this vital information.
Very kind of you being here. Thank you very much for sparing this time. Thank you.
Thank you. ਆ ਸੀਗੇ ਟੋਰਾਂਟੋ ਪੁਲਿਸ ਸਰਵਿਸਿਜ਼ ਤੋਂ ਸਰਜੈਂਟ ਅਮਰਜੀਤ ਕਾਲੋਂ, ਜਿਨ੍ਹਾਂ ਨੇ ਇਸ ਇਸ਼ੂਜ਼ ਤੇ ਪਾਰਟਿਕੂਲਰਲੀ ਐਡਿਕਸ਼ਨ ਇਸ਼ੂ ਤੇ ਕਾਫੀ ਕੰਮ ਕੀਤਾ ਪਿਛਲੇ ਕਾਫੀ ਸਾਲਾਂ ਤੋਂ, ਔਰ ਉਹਨਾਂ ਦਾ ਕੰਮ ਜਾਰੀ ਹੈ। ਡਿਮਾਂਡ ਔਰ ਸਪਲਾਈ ਦੀ ਗੱਲ ਕੀਤੀ ਹੈ। ਜਿਹੜੀ ਸਪਲਾਈ ਹੈ ਉਹ ਕਾਫੀ ਸਾਲਾਂ ਤੋਂ ਚੱਲ ਰਹੀ ਹੈ, ਲੇਕਿਨ ਜਿਹੜੀ ਡਿਮਾਂਡ ਹੈ ਸਾਨੂੰ ਉੱਥੇ ਯੂਥ ਨੂੰ, ਐਡਲਟਸ ਨੂੰ ਐਜੂਕੇਟ ਕਰਨਾ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ। ਕਾਉਂਸਲਿੰਗ, ਐਜੂਕੇਸ਼ਨ ਕਿ ਕਿੰਨੀ ਖਤਰਨਾਕ ਡਰੱਗਸ ਹੈ, ਬਿਕੋਜ਼ ਜਿਹੜੇ ਡਰੱਗ ਡੀਲਰਸ ਹੈ ਦੇ ਆਰ ਨਾਟ ਲਾਇਸੈਂਸ ਟੂ ਸੈਲ, ਜਿਹੜੇ ਰਿਟੇਲ ਸ਼ਾਪਸ ਹੈ ਦੇ ਆਰ ਨਾਟ ਲਾਇਸੈਂਸ ਟੂ ਸੈਲ, ਸਟਿਲ ਦੇ ਆਰ ਸੈਲਿੰਗ and they are mixing, so it becomes more harmful, more dangerous, and our youth or adults are taking these drugs. That's why we have these government data of 200 deaths per day across Canada. And if we talk about the Ontario, 7 deaths per day is happening here in Ontario also. So serious concern. Our government should look into this and control this. And our government should look into this and act immediately, because we can't afford a single life lost.